is sponsored by Dignity Health Central Coast.
Neck pain or numbness and tingling in the arms and hands can be indications of degenerative joint disease in the neck, causing a compression of the nerves. When this happens, a surgery may be needed to fuse the bones in the neck, which also prevents that joint from moving. However, neurosurgeon Dr. David Ye at French Hospital Medical Center explains that artificial disc replacement could offer a motion-preserving option for some patients.
We have the option to take away the joint and decompress the nerve roots and insert an artificial disc prosthesis, very similar to a hip or a knee. And in that way, we take the pressure off the nerves and the nerves can function normally again. And also the joint is preserved so the neck can move normally as well. This is referred to as a cervical disc arthroplasty or disc replacement.
This surgery can be performed as an outpatient procedure, meaning patients go home the same day.
We encourage the patient to move their neck immediately. They are typically back to their normal activities within a few weeks. I want my patients to know that we can work together to optimize your neck function and use cervical motion strategies to get you back to where you were and what you like to do.
If you need neck or spine surgery, have a conversation with your surgeon to determine the best option for you. If you don't have a doctor, scan the code on the screen or visit dignityhealth.org/Central Coast. I'm Kristen Presall.
HealthBreak is sponsored by Dignity Health Central Coast.